Today, Health Watch is back bigger and better. I know you missed me, I missed you too, and it's always a pleasure to do this with you. On today's episode of the program, our focus is on integrative medicine, and that we're talking about the benefits of integrative medicine in Nigeria or in our society today. And I have someone very interesting I would love you to meet. But again, we have other things to talk about on the program. We have a feature on radiation and cancer. So there have been speculations that the radiation that comes from technical mass could or may cause cancer. We don't know how true that is. That you will find out on this episode of the program. My name is Nkem Okere. We'll go on a short break. When we return, you'll meet my guest. Stay with us. You're welcome back, and the program is Health Watch, reaching you on the Station for Excellence NT Lagos channel. Then I know, just like I said earlier, you missed us. We are back. It's a 25 minutes program that talks about health-related issues affecting men, women, and children. Of course, what is happening in the health sector, what's happening in the health world. And today our focus is on integrative medicine, the benefits of integrative medicine in our society. Our guest today is someone who has spent about 11 years in the medical field and 10 years in integrative healthcare. She is an integrative healthcare practitioner. I'm talking about Dr. Faith Okere. You're welcome to Health Watch.
Thank you, Mom.
You just look as beautiful as this name we're talking about implies. So you're welcome to Health Watch.
Thank you.
And we are really glad to have you on the show. Now, talking about integrative medicine. Yes, we know that internet is there, but it's not enough. And that's why this program is here, to help people understand. So what are we talking about when we say integrative medicine? What field of medicine is this? What does it focus on?
Okay, integrative medicine is actually a combination of the conventional medicine and best practices from complementary and alternative medicine. So it's like having the best of both worlds. So in integrative medicine, we are looking at the person in whole, in total. So it's like holistic medicine. We talk about the physical, we talk about the mental, spiritual, and emotional well-being, and not just, the physical body alone. So we go deep, finding out the root causes of diseases and trying to solve diseases from the root, and not just, trying to help with symptoms alone. So it's actually more patient-focused, and we look at wellness, promotion of health, and that's what integrative medicine is really all about. So it's a deeper form of medicine.
So would you say that there is a big difference between conventional medicine and integrative? What's the difference? Give us that. Let's understand where the distinction is there.
Yeah. Complementary medicine, conventional medicine is more disease focused.
Okay.
While integrative medicine, we are looking at wellness focused. So in complementary or in conventional medicine now, we treat mainly symptoms, while in integrative, we are going to the root cause of the problem and trying to solve it from the root cause so that every other thing goes. And in conventional medicine, we don't talk much on nutrition, some of these things that we found out to be very, very, that have a very great impact on people. We focus more on the physical health. But in integrative, we are going much, much deeper. We look at the emotional, we look at the physical, we look at the spiritual, and we look at the mental state. Someone that may just come to the hospital with headache or something, conventional medicine will be thinking of solving the pain or the headache. But in integrative, we try to find out, is it an emotional problem? Was there an issue at home? Is it stress of work? So it goes deeper. It's more of a comprehensive approach to patient management.
Let's make it easy for the common man to understand. So I come to your hospital and I have malaria. So give me an example of what's your approach to that.
Malaria, those are like straightforward cases.
Okay.
Now when we are looking at integrative, we are talking about those ailments that conventional medicine really don't have solutions for. Most of the chronic ailments. We're talking about the hypertension, diabetes, cancer, that they say you have to be on it for life. And then we are looking at autoimmune diseases. We are looking at mental health. There are some things that even in medicine, someone may come with a form of allergy. But if we really look at it from the functional point of view, that's integrative point of view, it's something connected with the gut. So malaria, yes, we know malaria is malaria everywhere. That one can be treated by conventional medicine. So conventional medicine is also important. They have their place, especially in emergency medicine. But when we talk about chronic ailments, that is when the beauty of integrative medicine comes alive. So we now look at, okay, like someone may come and say they have frequent malaria every 2 weeks, every 1 month. For integrative doctor, we know there's an underlying immune deficiency. So we look at that. We don't just, run lab and then give you malaria prescription. No, why is this person having frequent malaria? We start going deeper. Is there an issue with the liver? Does this person need to detoxify? So that's the difference between a conventional approach and an integrative approach.
What has been your acceptance level? I'm sure you have people in this field also. So what's the acceptance level in society like?
Well, in Nigeria, integrative medicine is just picking its ground.
Okay.
But in Europe, it's majorly practiced there. Germany, Mexico, Switzerland, they are looking more into integrative medicine.
So why is it just picking up in Nigeria? What could be the issue?
Well, our doctors here, most of them are not really open-minded. Let me use that word. Okay. The world of medicine is changing. People are tired of the norm. Unfortunately, that's why they are falling into the hands of all these quacks that you see around, because people are tired of having to be on drugs for life. Okay. People are tired of having the same thing given to them every time. They tell them, come back, they're giving the same thing. So people are looking outside the box. But our doctors here, except for very few ones, have now started, having a paradigm shift. But we are very, very slow, and it's very, very slow. But we hope with time, because right now we are trying to integrate some societies, of integrative medicine, trying to create awareness and to tell we're not antagonizing the orthodox, no, but we are trying to complement, to give us a more comprehensive, treatment approach to issues, and so we have a better patient outcome. And in integrative medicine, because we are involving the patient, we allow the patient to take an active role. Unlike in conventional, that the doctor just comes, you prescribe, you give and go. No. In integrative, we try to have a patient-doctor's kind of partnership. So you are like taking ownership of your disease. You are taking control of your, of your disease. So we find out that patient outcome is better. Patient empowerment, because we educate you, we tell you a whole lot of things. Orthodox medicine, maybe because of the crowd we have, they don't have the time to start breaking down things for patients, and that's one of the major things we see patients complain of. But in integrative, we may spend 1 hour, 2 hours consulting, because we are trying to find out what is the problem. So patient empowerment is actually key, because we want you to be empowered to take informed decisions about whatever it is you are going on.
So are people aware that there's something like this? Because why I asked that question is that there's a high rise in chronic disease and the spread. Will I say spread in the number of people affected? Prevalence rate, and so you see a lot of people coming down with different kinds of cancers. I can't remember hearing this while I was growing up, but now it's a regular thing. People say they have cancer of the mouth, cancer of the cervix, cancer of the thorax, cancer is just everywhere. So if there is a field of medicine that can approach it from the way you're talking about it, why are people still not aware? Or are people aware and they are refusing to accept this kind of medicine?
No, I think there's actually low awareness rates.
Okay.
And that's something that we have to try and change with education. Thank God a lot of people are coming up with nutrition. Previously in medicine they say it doesn't matter, eat anything. No. We found out that what we eat and what we absorb really, really has a very great impact on our health. So the awareness is gradually creeping up. Thank God for the internet. People are beginning to question the norm.
Thank God for Health Watch. Thank God for NT.
So people are beginning to question the norm. Why must it be like this?
Okay.
So it's going to take some time, but we are going to get there. Because abroad, they have a lot of, in fact, you will see patients querying their doctors because they've gone to read about a lot of things before even approaching. But here we don't have that. And a lot of, maybe it's the system, the healthcare system. People have been known to just depend on their physician. They don't want to do anything, Okay, you just tell me what to do. No, it shouldn't be like that. We have to learn to take responsibility. I always say your health is your responsibility. So take responsibility of your health, play an active role. Get informed. Why do I have this? If they're giving you any medication, what is this one doing? What is this doing? So when you are actively participating, you find out that, yes, you'll be more compliant. Because the other one, after a while, they just, drop it somewhere until there's a complication. But in integrative, because they feel they are part of their decision makers. So outcome is better because they will comply better. So the awareness is gradually coming on. But we need more programs like this to really tell people that, look, there is an option. And integrative is talking about comprehensive, you holistically. So it's just like you have a car issue. Maybe a light in your dashboard. You don't just go and pull out the wire. You have to find out why is this there, why is this there. And then when we're going to maintain the car, we check our fuel filter, we check our oil filter, we check, everything.
All around.
So the body is also a complex organism. So we need to take in consideration different parts of the body if you are really looking at health. Because if you look at WHO definition of health, is physical, mental, social well-being, and not the mere absence of sickness or infirmity. And that is what integrative is really talking about. So the awareness is creeping up gradually, but it's very, very slow. So we need more programs, really, that is going to create awareness. But thank God in Abuja, the TCAM, they are trying to, come up with some bodies and trying to let people to know more. So
I was going to ask that question, if you have a body.
Yeah, so if they train physicians, I think they can be more open and then show them. The issue we are having most times, because most doctors, they want research-based, evidence-based. Unfortunately, with complementary medicine, because most of these things that are done cannot even be patented. So we don't have concrete study. We have just anecdotal studies. But like somebody said, triple blind, double blind, as far as he's getting results with his patients, he's happy about that. True. So it's a gradual process. True. And everybody is individualized. When it comes to integrative, there are no two patients that are the same because we have different genetic wake-up. When in orthodox medicine, what do? We have patient hypertension. We're giving them the same set of. So in integrative, is individualized, personalized, patient-centered treatment. That's the beauty. So with time, people will get aware and then start. People are talking about nutrition now, exercise, this diet, that diet. So people are gradually, picking up. But we need more education. That's the truth. We need more education.
We'll go on a short break at this point. When we return, we're talking about the challenges and the benefits of integrative medicine. Stay with us. We'll be right back. Welcome back. It's still Health Watch, and our focus today is on the benefits of integrative medicine in our society. And my guest is still with me in the studio, Dr. Faith Okere. So before we went on the break, we talked about creating awareness, and of course, you also mentioned that there's a body that is also trying to make sure that people are aware of this field of medicine. Now, going forward, what are the challenges you face as an integrative medical practitioner?
Because like I said, it's not really, for now, well accepted in Nigeria. It's just taking its roots gradually. So some practitioners, or many practitioners don't even understand what we're doing. So they feel it's quackery. And some that have an open mind, they go online, find out, okay, it's as if something is going on. Because right now, a lot of schools, like I had even the University of Arizona, they started integrating integrative medicine as part of their medical curriculum. Okay. So we are also looking at that for Nigeria in future, because it's going to really open up our students' minds. Because when you're younger, you want to learn, but when you are older, we don't want any new stuff most times. We don't want to really read. So I think that's actually a restriction. But for those that are really open-minded, they go to, read a whole lot, and they started accepting things, because this evidence you see is too good to be just coincidence. There are a lot of hospitals that when they use the integrative approach, they get fantastic results for cases that normally would have just been there and for life. So one is that people don't really understand the awareness, even practitioners. And secondly, because there is no regulation, licensing, everybody just come up, I'm an integrative. They don't even know the meaning of what integrative private medicine practitioner is. So we need that licensing. People really need to, and it needs to be a body to regulate. That's why I talk about the traditional complementary and alternative medicine. They've started trying to, come up with some regulatory bodies so that most of all these quacks, can be put to rest. Why those that really knows what they are doing can be highlighted. And we also have the Integrative Medicine West Africa, which is a body. We are trying to see how we can integrate integrative medicine in our medical curriculum on postgraduate level. So some things are going on. It's a very slow process, but we'll get there. So the more practitioners are more open-minded, the more we go out of our comfort zone. A lot of people don't want to leave their comfort zone. We go out of our comfort zone to find out what are they really talking about. What's the truth? Show me what you have. Is to go a long way. And then we find out that for integrative medicine, the patients are happier because most of them are able to open up to you. Most doctors don't have that time. Everybody is in a hurry. You finish 20 minutes, 30 minutes, you finish your consultation. But for integrative medicine, patient is there for 2-3 hours. You're just talking. Yes. You're just gisting, trying to know more about this person, because that's going to give you some inclination. So most doctors don't even have the time, especially in our government hospitals that are already overburdened. So that is a challenge.
You have one doctor to 500 patients.
So it's a very big challenge. So if doctors can have a little more time to themselves, and there are actually incentives to, help people, go out and see what is going there. You'll be shocked. You'll be shocked. So licensing, regulation, and having an open mind, and practitioners' education is really, really key. Because for a lot of the practitioners on this integrative medicine in West Africa, they are open-minded, and they are the little they have incorporated into their practice, like ozone therapy, like mistletoe therapy, vitamin C high dose injections, they've seen amazing results. And the cutting-edge technologies, that's the beautiful part with integrative. We have some beautiful, almost magical or miraculous devices. They will know that actually
you can only get better.
Yeah, revolutionize your practice. Something like the thermography camera I had to get from Germany. That can even pick up if issues in the breast even before you have a lump. That mammogram can pick up.
Wow.
So over there, technology has really advanced. So we really need to get, and there's something called undermade device. That's another one, which your body is the one that speaks to you and tells you what is wrong with it, and you'll be able to correct it. So these are not devices you find in orthodox medicine, but in integrative, yes. The patient themselves have a lot to play, and that's why we have to carry them along. Very, very important. We have to carry them along, because we are not going to go to their house to see how they eat. We have to tell them the importance of why they have to eat, why they have to take the right water, and taking adequate water. Because chronic dehydration is also another major cause of a lot of problems. You don't see people telling you in the hospitals that drink water, except maybe they have kidney stone. But generally, it should be, water. And then supplementation, like I tell people, is not an option now, because the food we are eating is deficient. The agricultural practices is faulty. We are using a lot of fertilizers. Fertilizer is just NPK, three of the essential things that we need. Our body needs about 81 minerals and vitamins, and we're getting 3 from food, so our body is deficient. Supplementation is key. Stress level is also really, really massive, especially if you stay in Lagos. I said here in town, So
okay, let's really come to the crux of today's topic, today's focus. What would you say are the benefits of integrative medicine? Because from all you've said, I'm sure a lot of people are waiting to hear, okay, tell us the benefits, how we should move to this.
Yeah, the benefits of integrative medicine, number one, you have better patient outcome, because they are carried along, they are informed, so they are taking better choices. So, and patients are also empowered, because they know now what they need to do to get better. And also, integrative medicine is like bridging the healthcare gap, bridging the gap between the conventional and the orthodox. So, like a lot of complications that arise from the use of orthodox medications and the rest, integrative medicine can handle it. Like most of the chronic diseases we talked about, that we're just managing it in conventional. Integrative medicine can take care of it. Chronic pain management, integrative cancer care, integrative mental health. So those 3 are very, very important, because when we can deal with those 3, we'll find out that we have a healthier society at the end of the day. So better patient outcome, patient empowerment, and then bridging the gap. So that's 3 beautiful benefits.
Wow. Thank you so much for coming on Health Watch. We'll be speaking with Dr. Faith Okere, an integrative healthcare practitioner, and she has said a whole lot on the benefits and why you should, of course, you should be thinking about this now. For all of us that are at home and are asking ourselves, what should we do about this? This is what we do on Health Watch. We bring you information, we educate you on what you need to know. You need to step up your game. For even the medical practitioners, Dr. Faith has said a whole lot today. Thank you once again for coming on the program.
Thank you, ma'am, for inviting me.
As much we can take on this week's edition of Health Watch. Remember, I normally say that health conscious people live longer. Send a mail to us on okibenkem@gmail.com or send the SMS only to 07060865487. Thank you for being part of this week's edition. See you next week. My name is Nkem Okibe.